What is anxiety? Anxiety is a mental health disorder characterized by feelings of worry or fear that are strong enough to interfere with one's daily activities. Anxiety is very serious. An anxiety disorder may cause loss of appetite and lack of interest. Other symptoms include muscle tension and headache. The constant state of stress can lead to clinical depression. Anxiety can pretty much ruin your life. It can confuse your own nervous system. In short, the autonomic nervous system is a part of your nervous system that regulates the internal organs like your heart and stomach, but also controls your cardiac muscles and glands. Your nervous system does not differentiate between danger and stress. It acts the same towards both issues. It increases your heart rates and cuts off any urge that you need, like using the bathroom perhaps. There are many types of anxiety, but I will talk about the most common 5, which are panic disorder, phobias, obsessive compulsive disorder, which is the most common, called OCD, post-traumatic stress disorder, and acute stress disorder. Disorder is the experience of intense anxiety along with feelings of dread and doom. This is accompanied by at least 4 symptoms of autonomic hyperactivity, such as trembling, chest pain, fear of dying, chills, shortness of breath, nausea, and dizziness. These sensations typically last less than 30 minutes and may be accompanied by agoraphobia, defined as the fear of places where escape is felt to be difficult. Phobia. A phobia is the fear of an object or situation and the need to avoid it. Phobias may be learned and involve 2 main types. Specific phobia, fear of an object such as animals, heights, or cars. Social phobia, fear of a situation such as public restrooms, eating in public, or public speaking. These involve situations where something embarrassing may happen. Obsessive compulsive disorder. Obsessive compulsive disorder is most commonly known as OCD and is one of the most commonly known anxiety disorders. OCD is a disorder where patients typically experience obsessions alone or most commonly a combination of obsessions and compulsions. Obsessions and compulsions. Obsessions are thoughts that are intrusive, senseless, and distressing to the patient, thus increasing anxiety. These include fear of contamination. Compulsions are rituals such as counting and checking that are tend to neutralize thoughts. These are time-consuming and tend to lower anxiety. Post-traumatic stress disorder and acute stress disorder. In both post-traumatic stress disorder and acute stress disorder, individuals have been exposed to a stressor in which they react with fear and helplessness. Patients continually relive the event. PTSD symptoms last more than 1 month, while acute stress disorder symptoms last more than 2 days and less than 1 month. So how does this relate to the story? I believe that Francis has post-traumatic stress disorder and a phobia of supernatural coincidence. Why? Because ever since Jimmy has had his seizure, she's been afraid that he has another one, and that she makes up these rules because she thinks something bad will always happen.
Created using Powtoon.